I'm very happy that I'm meeting you today, so we can share our experience and information. And this is going to be the first video conference that is a special edition of Merck Africa Asia Luminary 2020. Since we had to postpone our conference, which was supposed to be held in Zambia, because of course the coronavirus pandemic, we decided that to have separate sessions of different fields and under separate different programs together with you, so we can catch up and share information, experience, and also it will be an opportunity to congratulate you for you being selected by the scientific committee to be enrolled in the 1-year online diploma in Southwest University for the Sexual and Reproductive Medicine. And I think this course is going to be transformational. Transformation of the landscape of fertility care in Africa. It's going to be also a very great milestone for women's health in general and fertility care and reproductive health in particular. Something that I'm very passionate about because it's a critical part of Merck More Than a Mother campaign. You know, this campaign is very close to my heart, which we started in 2015, and there is almost 17 Merck Foundation Alumni already was with us since a long time, maybe from 2015 or 16, from different countries. But we also have new candidates who are going to be joining our campaign and our noble cause of breaking the stigma of infertility and improving access to equitable and quality fertility care in Africa and in Asia. This is very important because it's not a simple training. This is a 1-year training which is going to really enhance your skills and practice. And this will reflect on people, reflect on couples, reflect on women, reflect on their quality of life, psychologically and physically. And I think I will call, I will look at you because of each one of you has the time to speak and to share his experience and testimony. I will start alphabetically from A to Z, and we'll start with Bangladesh. And there is Dr. Florida Rahman. She will share with us two things. First, the challenges in her country, because in each country we selected one person who will share the overview about the country and the challenges and the impact of this training that's expected and estimated to his country or his community. And then I will call each doctor after that from the same country to have 3 minutes intervention. And then we will start after that with Botswana, Gambia, then Ghana, then Kenya, Liberia, Malaysia, Myanmar, Namibia, Nigeria, Philippines, Rwanda. So I will alphabetically until we reach to Zimbabwe. I want to encourage you to study hard this program because it's a difficult one. It's not easy, but it's going to be very beneficial for you, very, very beneficial. And based on the grades you are going to have, the highest grades will be invited with us to our conferences and other activities. Because as you know, we are increasing in number at the moment, and this is not going to be suitable to have all of us in our annual conferences and other things. So we are going to use a parameter, which is the highest grade. We will select the highest grade, and is going to be invited with us this next year to our annual conference in Zambia. So I want you, and of course, you will see us in person, of course, in your countries as well.
Good afternoon, and my respect and gratitude to you, Rasha Kelej, and to Merck Foundation. I'm honored to be here and to say something about our country. Okay, Dhaka Medical College. I am working in Dhaka Medical College for many years, and it is the largest, most tertiary level hospital in this country. And
Yes.
there are 2,600 beds in our hospital, and for infertility, we have only 18 beds. But we have developed a separate reproductive endocrinology and infertility unit since 2019, and our all the outdoor facilities, including outdoor management of IUI, was started since 2016, and we have many statistics in every year, and we do IUI in about 40 to 80 patients per year, but our success rate was not so much promising during the last 3 years. It was about 5 to 6% for all patients, and for IUI it was about 16%. So, but my turning point of our journey is the visit of Mr. Venunier from Merck Foundation to our country. He visited our hospital, and then a meeting was held, and they select me as a clinician
So,
trainee.
Merck Foundation turning point.
Yeah. So
Yes.
I was selected for higher advanced therapy training in Bangalore under Dr. Kamini Erao. He's the great infertility specialist. She's the great infertility specialist, and my training was very rich and effective. I am very grateful to them for teaching me. And
How
of course,
many
to
eyes
you,
was trained with you, Dr. Rahman, Florida, with you from the same country?
clinician from Dhaka Medical College. There are two clinicians that are trained by, sponsored by Merck Foundation. And outside of Dhaka Medical College, another doctor, he's near to retirement, Dr. Joglul Haidar, he's also trained by Merck Foundation. And Dr. Musammat Shahina Begum, Shanta,
Shana, yes, yes. She's
she
also
has
with
taken
us
over.
in that training. Yes.
Yeah, but
This
you
is
have
great.
given training to many embryologists.
Yes, how many? Do you remember?
I can remember at least 4 to 5.
4 to 5. And this is
Dr. Aviva,
added value to the success of the cases and access for patients.
after getting training, I was trying hard to establish our IVF center with my director and my head of the department. She tried hard wholeheartedly. They tried, and ultimately we became successful, and we have started our own IVF center, and which was inaugurated in 2020, 10th August. So we
Fantastic. Congratulations.
thank you very much, and I think it's your help.
Thank you. And now can we go to Dr. Chow Bayamisi?
My name is Dr. Chow Bayamisi. I work in a primary hospital in Gumare. It's a small village in Botswana. But although it's a primary hospital, it acts as a referral for the whole sub-district. So before entering into like the objective or the future objective that I have, being given this opportunity, I would like to say thank you to Merck Foundation and Dr. Kelej for this great opportunity. It will really transform so many lives of women in Botswana in so many districts. I'll just briefly share my point of view from the place that I work in. So basically, we don't even have an SRH clinic where women can access help or just a simple consultation. So these women are already finding it difficult having to be seen as part of the OPD patients. So we all know that couples who have fertility problems, they require a long time specifically for consultation. So it makes it very difficult to see them in long queues of OPD patients. So this will actually help the country as a whole, because we won't necessarily rely on OBGYNs, specialists, who are very few at the moment. We as graduates of sexual reproductive medicine will be able to start the interventions where we are. So it is a very great platform. And as well as us in numbers, this creates a platform for us to even know each other and also start to be a voice of reason, to communicate with our government and also to get the ball rolling. So thank you very much.
Thank you very, very much, Dr. Chow. Thank you. And we will be talking again after you graduate, or even between, of course. So we can see what you're doing in the course and what is the impact. Thank you very, very much.
So much.
We have to start with Dr. Niji, Dr. Niji from the Gambia, to give us a small brief about the Gambia challenges in fertility care. Yes, great to see you, Dr. Niji. I'm so happy to see you, and Gambia is very close. I came to Gambia and I visited there. It was really nice. I had a very nice, also beautiful fish in Gambia. And I met a lot of women who childless women in Gambia, and they told me about their challenge. And now with this program and the 7 doctors who are going to be enrolled in this program, I think this also will be transformational for Gambia fertility care and women health. What do you think?
Thank you very much. Thank you very much for giving me this opportunity. I think, like other speakers have said, the challenges of infertility in Africa, Gambia is also not an exception. Currently, we have a very limited number of specialists in obstetrics and gynecology, and we have through the Merck Foundation, a lot of people have been trained. Like you said, about 7 people. I was part of the second batch who went to India to do the training. And generally, the knowledge we gather from that place has really impacted our clinical service in the Gambia. And we are proud to say some of the patients have really benefited from our training in India. When we came, we have been seeing infertility patients, and then some patients have definitely benefited from it. However, we must say that Gambia, we still don't have an IVF center. I think that's one of the biggest challenges we have. Currently, we don't have any IVF.
I think now, after you get
I think to do after this training,
you must be advocating for this in the.
Yes, exactly. We are making a lot of advocates to make sure that it is available, but we don't have any at the moment. And I think this training will go a long way trying to help our country to manage women issues, because currently a stigma of infertility has become even a case of gender-based violence, where women are harassed at home because they could not have a child, and in most cases which is not actually their own fault. So I believe after this training, this is going to have a huge impact on the Gambian population. As you know, we are not many, just about 2 million people. And if you look at the reproductive stage of that population, it's almost like 30 to 40% of the population. So I think going to do these studies is going to have a huge impact on the women's health in the Gambia. Not only infertility, but other health conditions of women.
Health in general, yes, would be great. So thank you very, very much, Dr. Niji.
Yes.
Okay, Dr. Elizabeth. Dr. Elizabeth.
Yes. Well, thank you Merck Foundation for choosing me to do this sexual and reproductive health program.
Thank you.
I'm yet to be enrolled. I think my application has been sent to March 2021, but I'm an obstetrician gynecologist working in Konfanochi Teaching Hospital in Ghana. The hospital is in the center of Ghana. The center of the country. That is where my hospital is. We have a lot of gynecologists in Ghana. We have a lot of gynecologists in Ghana. And then we also have IVF centers, but it is private in Ghana. So we are yet to start an IVF center in the public sector. But I see a lot of women who come to my hospital who have infertility problems. And doing this course will immensely help me. Like all the people have shared, in Africa, if you get married and you don't have a child, it is a stigma. And in Ghana now, people are going to school and getting married at an older age. And we all know that if you don't get married early, then fertility becomes a problem. Doing this course will actually help me to help me better to take care of women who, especially those, majority of our people have tubal problems.
Yes.
For some reason, that is what we are seeing. And then those who have immensely helped me to see to the women I see who have fertility problems. So thank you very much.
Thank you very much, Dr. Elizabeth. And see you for sure when we come to Ghana, because we are going to come for sure next year. We have Dr. Ruth now, Wami, from Kenya. So she will share with us her insights and highlights about the Kenya fertility care landscape and the impact of the training she's anticipating for herself and for her region and country. Dr. Ruth?
Okay. Thank you, Dr.Rasha, for the opportunity to study the course and to participate in this conference. My name is Dr. Ruth Wamai from Kenya. I work in the capital city. I don't work very far, but I work in a mission hospital where we serve a lot of people. So the challenges are different in Kenya compared to some of the other countries that I hear. For us, we have a lot of gynecologists trained, over probably 400 over the years. But then the issue in Kenya is that the pressure on the system is because of obstetrics and prevention of things like maternal mortality. So there's been very little focus on providing services like infertility for the women. So not a lot of training has been focused on that. So, but this year, we are, thanks to Merck, we also have been reactivating our Fertility and Andrology Society of Kenya. So they've helped us a lot with that. And we feel like the problem in Kenya mainly is advocacy, so that people can also spend more resources in providing fertility care and even encouraging insurance HMOs to also cover patients for fertility care, because it costs almost like 4,500 to access fertility care in a private center. So this area hasn't been developed very well in the mission hospitals or the public sector. So I think my training in this course is going to enhance my care to these women, because sometimes they come and you've got nothing to offer them other than just directly referring them to a private center, which they cannot afford because they pay so much.
So Dr. Lois.
Hi.
Yes.
Hi, Dr. Rasha. How are you? This is
good to see you. Of course. You know, I feel that we've seen each other before, because I have seen your video, I have seen your posters and all this, which we are going to do for all the alumni also. And I will share with them your success story as well. So Dr. Kuputu, I wish that we can meet very soon in Liberia, but our meeting was cancelled due to Corona, as you know.
Yes.
To make the proper and the formal launch. But I would like you to give us also an idea about Liberia, and this is very important for all the colleagues to understand.
Yeah. So there's a lot of improvements as it relates to infertility in Liberia since the training of Dr. Kopuzolo and myself and the three embryologists.
Great.
We have started, as she said earlier, we have started consultation and we have had some success stories. Although we are not doing IVF, but we are still using some fertility drugs like Clomid, and actual timing that we have some success story. Like yesterday, I called her and said that I think we need to help our society because there is no fertility society of Liberia. So I was telling her that I think that we need to talk with the other doctors.
We have the number now. We have 3 embryologists, yes. You have 9 doctors. So yes. It's a huge number. I will be with you in the society.
All right, thank you. Yeah. So I think the next time we speak with you, we'll be telling you about our society. Basically, that's what we have to say. Thank you so much. Thanks, Mark, for helping us. Yes, and we're always there to give. Yeah.
Thank you. So, Myanmar, we can go to Dr. Keen Lat.
Good afternoon, Dr. Rasha. and
Good
other Merck
afternoon and
Foundation
congratulations for the new IVF and the new babies.
Yeah.
Please give us an idea, small idea about this to our colleagues.
Now we have many success after we got the training from the Milan Center, IRH. So we got the trainings 3 months. So we got the trainings, 3 months training from Milan Center. Only 3 of us. One is embryologist, and now she is very skillful. And the other 2 are clinicians. Now we are running the center very well. Now we got the success, and then I sent the photos of us. So now we are very much thank you to Dr.Rasha and all.
The first public IVF or the first IVF in Myanmar in general?
The first IVF is I think in 2016. After that,
the first public?
Public, yes. Our center is the public center.
Yes.
Yeah. Our center is the public center. Yeah.
Very good.
First of all, good afternoon, everyone. I'm currently in Windhoek. I'm working as a I'm working as a junior medical officer in the Department of Obstetric and Gynecology. So just like how everybody mentioned earlier on, Namibia, like any other country, is not immune to stigma and lack of accessibility to fertility treatment. And I think the best part about Merck Foundation is giving us the opportunity to actually gain the skills that we require to combat most of these issues. But my biggest worry will be then not be able to effectively practice most of these skills that we are acquiring, or not be able to effectively treat the patients, considering that we have lack of resources or accessibility to infertility centers here back at home. Like in the whole country, we only have two fertility clinics, and they are in a private sector.
Now we are moving to Nigeria, and we have Dr. Adwell.
Participating in this course is going to give me a rounded knowledge so that I will know about female and then male fertility problems, and then I can be able to provide care to both males and females, and in partnership with the obstetricians in my center, because I don't think that there are many public sectors, public hospitals that are offering in vitro fertilization, but I think that there are lots of private settings. Also, the problem with stigmatization, if we can create an awareness, like you mentioned earlier, that women are actually more than mothers. So, I mean, and then it takes a man and a woman to actually have a baby. So I think, awareness is going to be well appreciated. I want to thank you very much for this opportunity, and I hope to be able to make the most of it. Thank you very much.
Thank you very, very, very much, Dr. Adewala, yes. Thank you very, very, very much.
All right.
And I'm sure that we are being touched to be able also to raise awareness about this course in Nigeria for different provinces. Thank you very much. Dr. Margaret John.
Hello.
Hi. Hello. Hi. How are you?
I'm good. You are good? Still good, doctor?
Yes, I am. I'm trying to continue.
So I am Dr. Margaret Christy Limson. So I'm a junior consultant from a government hospital. So I work in the Department of Obstetrics and Gynecology. So it's a university and university government hospital. So I teach students, residents, and we have fellows in endocrinology and infertility. So if you understand, the Philippines is a very small country, but we have a population of about 110 million. Okay. So, but then we realized, when I was doing my training when I was a fellow in the government hospital, that we do see a lot of people who are not rich, who still come and consult for fertility. So understand there are only probably 3 centers in the Philippines that will give what we call charity treatment or charity services for infertility. So I'm very excited because our hospital, no, I'm affiliated with the University of the Philippines, Philippine General Hospital. For the past 5 years, we've been planning to open an IVF center. It will be a government-funded IVF. Yes, we are very excited, but still, we are just still very excited because we are still, the structure is not yet there 5 years today. So with COVID, everything slowed down.
Make it faster now.
We hope, no, in 2 years. That was the plan 2015, 2017, but it is now 2020 and still no infrastructure. But we are still very hopeful. And we hope that we will be able to extend the services that, the people need, especially those who cannot afford the fertility services.
Definitely. Thank you very much, Dr. Margaret. Thank you. I wish you good luck, success.
Thank you, Doctor.
Thank you.
Greetings to all my colleagues.
Great.
Much has been said about infertility, but I would like to thank you all for your support and the knowledge towards the managing of infertile couples. So without taking my time, I've seen the approach of infertility management as interesting, because the way infertile couples are managed is the way other diseases should be managed, from the healthcare, from the health center, referral up to the highest level. So looking at the infertility management, really we should look at it from the health center point of view. If we don't have so much skills like IVF, really after this knowledge I've acquired, you can really manage these couples as if we can manage at the health center levels. For example, I've seen patients who have been coming to our clinic, the public clinic, with the incapability or no capacity to pay from the private. And when I give them management proper one, not using much, not using much expensive drugs, and they conceive and they have a story to tell. So I see it as it's really a good package to manage infertility at all levels, not necessarily at the IVF big centers. We can know how to manage these patients at a low level, then we can transfer them at a higher level. So really, since we've got this, this knowledge as 11 doctors from Rwanda, we can always advocate or manage this patient at our lowest level possible, and where necessary they can go for IVF.
Now I will go to Sudan, and there is Dr. Al-Sheikh Al-Tayyib Omar Karar. Dr. Al-Sheikh.
Good afternoon, everyone. Thank you, Merck for giving us this fantastic opportunity to join this prestigious diploma program. I was honored to be selected by the society here in Sudan, the SHRES Society, Sudan Human Reproductive and Endocrinology and Embryology Society. The practice of IVF, let me start by the infertility stigma. It's the same as in the Arab world and the African continent. The woman who is not able to reproduce is considered as a stigma, and the problem increases by the cost of treatment. The cost of treatment is very high, especially when you know that the only access to fertility treatment is through the private sector. We only, as you know, Dr.Rasha, we have one center that is affiliated to the University of Khartoum, which is the Abu Layla Center, but still it's not 100% public. It's still the patient have to pay a great amount of money to do the investigations, the workup, the treatment, and so.
Thank you, Dr. Dal. Tell me, are you from Kampala or?
Well, my name is Del Mugisha, and I'm from the southwestern region. That's almost at the border of Uganda and Rwanda.
Very good.
It's about 7 hours from here to Kampala, actually.
You know that this makes me very happy, really, because this is how I want to distribute this. So tell me, Dr. Dal, just to tell you, Dr. Queen and Dr. Flavia, I have done this program in Uganda, the second country after Kenya. It was 2015, and we've done a lot of programs to empower infertile women, almost 1,000 women. We have established for them childless women who did not have infertility children. And we established for them small businesses, chicken farms, and oxes and plows and cows and all this, and the catering services, restaurants, small restaurants in the villages, very, very far in the western Dororo and all this. And they were very, very excited, and their life changed totally. And if you see them before the project and after the project, they become different people, different strong women. Even the tone of their voice changed. The way they walk, the way they look is totally different. So I feel this is the best way to do a business study or study about how economic empowerment can change women, not even regular women, but women also who's been stigmatized and abused by society, how they change. Now the community respects them. They come to ask for work from them, to work with to them. Before they were ignoring them, they insult them all the time. So the whole things have changed, and this is 1,000 women in Uganda. And you can see the videos in the thing. So that's why I'm very excited about Uganda. Yeah.
I actually watched you in 2015. You're
Really?
an icon when it comes. Yes, you know, when I was listening to you, I could see the passion. It was on NTV. I saw you even handing over some of the plows and something.
Yes.
Your reputation precedes you when it comes to the fight of stigma. Actually, it's quite good.
Thank you very much. I wish with you, all of you, that we can continue this work even further and in different regions. So I'm waiting until you get to know the force better and get stabilized, and we can work together to achieve this more and more in Uganda. So, Dr. Dal, so can you please continue? Sorry, I interrupted you.
No. That is very good because I can see the passion.
Yes.
When you spoke of Uganda. Yeah, I would also like to really, just like the other speakers before me, I'd like to thank Merck Foundation for the opportunity, honestly, because it's something that I have always wanted to do, but it's not something that's quite affordable. So I really thank you for the opportunity. I had started, I also would like to thank you because one of the concerns that I had was if I'm going to do this thing online, it would actually be very helpful if I had some hands-on skill or something so that I can be able to do this.
Finish this, and then when coronavirus comes, we will send you 3 months to India for enhancing the fertility session.
Yes, that would be very fantastic. So I just wanted to say thank you because that actually had to say that.
All of you are having this opportunity, if you want.
Yeah. Yes. Yeah. So where we are, I serve the hospital where I am is a public hospital, and it's a regional referral hospital with a catchment of 2 million people.
Yes.
But even the next hospital just after us, that's also a regional referral hospital, something about a catchment of 7. There is no reproductive health specialist. So this is quite good. The impact of the training has already begun because, yes, I'm a gynecologist, but I had never taken into account, for me, reproductive treatment has always been, to the scope of IVF. But attending the course makes you wake up to some of these other things that you can do, like time sexual intercourse, like IUIs that can be actually done. And I'm planning to do my first IUIs very soon, like in about 2 weeks' time.
Dr. Mulaya.
Hello, good afternoon.
Hello, good afternoon. Another card.
It's been a long wait, so now I have errands.
Hello. Looking forward to Zambia very soon, hopefully next year. So, Dr. Mulaya, can you please tell us?
Yeah. So, thank you. Yeah, thank you so much for this opportunity. It's been exciting, and I'm excited to be here. And just to give a short report on what has happened, I went for the fellowship to India in 2019. I actually missed my graduation because the day of my graduation for my post for my MEd, for my obstetrics and gynae, I was actually traveling to India, so I chose to go to India and miss the graduation, and I don't regret it. It was an excellent experience. We went to a center where they're doing IVF. Their success is quite good. They're doing almost everything that's in the book, and we learned quite a lot. There were simulators, and I think it was a great experience. Yeah. So now to be enrolled for this course, is actually
compliment all what you have done in the theory.
Yeah, the theory is actually amazing. Now I'm seeing most of the things that I didn't understand, even with the practicals. You know, you could do the practical, but you need to know the science behind it. So knowing the science behind it is actually exciting. Yeah. So with this experience, like all the people have said, you do get discouraged when you think we don't have an IVF center and oh, what am I going to do with all this information? But like the previous speakers have said, actually you don't need an IVF center to make a difference. The route that you take is actually, for me, I've decided even just breaking the silence about the infertility and all is actually a big step in the right direction. I'm now in a number of groups for infertile couples, infertile women. So I'm actually 13 years. Someone has never had an HSG done. So that there's actually very small things which we can do to make a difference. It doesn't have to be an IVF center. Just taking a history, teaching women about their calendars, teaching a couple. You know, I've got couples that came to me with infertility and things like that. But just telling them this is a fertile period. You talk about the cycle and just show them which days are fertile. I've had some who've actually come back pregnant without me doing anything actually.
Wow.
So it's really the small things that make that actually make a big difference. Yeah. And prevention, we cannot overemphasize prevention to prevent the tubal blockages. That's what the biggest problem is in Africa.
Dr. Daniel, where are you from? Which part from Zimbabwe are you in now?
I'm working in Mashonaland West.
Okay, great.
The province in Zimbabwe.
Are you excited about the course?
I'm very excited, and thank you for giving me the opportunity to partake in this curriculum.
Very good. And what do you wish to do with it after you finish? What is your plan?
To help my community, because my community there's a high burden of STIs and subfertility as well. So I think
there is a high incidence of infertility related from untreated infectious diseases.
Sorry?
There is a high incidence of infertility, which is resulting from untreated infectious diseases.
Yes, but
so
most of the
is very important as well. So are you willing to, you are planning to do the awareness required? We are going to send you also awareness materials. You can maybe hang in the clinic and share it with your community.
I'm very willing to do that, working with media personalities as well, as much as we can to sensitize the public.
And getting your media partner from the media people. Just think about who is the journalist who I can make a friend with. So he can really put some information in the media to raise awareness about the people.
Yes, I'm writing a few names, a few ideas. I think I can come up with one.
Fantastic. Thank you. Fantastic very much, Dr. Daniel. So I'd like to thank you all, my team, for make this happen, and I'd like to thank all our alumni and the future alumni, future experts. I'm proud of you all, and I am hoping that you are going to be the future experts, future healthcare leaders who can make transformation in the public healthcare sector, who will be able to make transformation in the women's health and fertility care and reproductive care in the two continents. Thank you very much for your time. I know it was exhausting, but it was necessary and very beneficial. I would like to have this in maybe every 6 months or 4 months. We can know each other all. Can you please mute? So, I hope this is going to be a great platform that you are going to be to connect together after we finish. not going to be the last one. Thank you very, very, very much.